Hello and congratulations, you've made it through the liposuction procedure here at MyShape Lipo. The couple things that we want to talk about with you in your post-op after you've had your procedure, there's some simple things that you can follow to make your healing process a little bit easier and perhaps a little bit quicker. What I want you to do is wear the compression garment 24 hours a day, 7 days a week for at least 2 weeks. Some people may choose to wear the garment longer. Most people don't particularly love wearing the garments. They can be a bit uncomfortable, but wearing the garment is the most important thing to your healing process because it decreases the swelling that you would have in the treated area. So it's important that you wear it as much as possible. Obviously, you're going to want to take it off for a shower. And you want to, if you need to launder the compression garment, then you can do so at that time. But you want to put it back on as soon as possible. Every time you put the garment back on, you'll want to change your pads if they need to be changed. Some of them may not have any drainage on the pads, so you don't necessarily need to change those unless the pads are filled. After the procedure, it's expected that you will be draining, and how much you drain, it varies from patient to patient. So some people will drain a lot. In fact, it's not uncommon for the drainage to actually squirt out projectile fluids, which is kind of fun, but it can be messy, so just be careful. These are all fluids that we put in you to get you numb. They will be pink or kind of red tinged because since they're in your body there is some blood there, but rest assured it is not blood and you're not losing a tremendous amount of blood with this procedure. It's just a tremendous amount of fluid that we put in there. So don't be scared. The more you drain, the better. As far as changing the pads, you're going to want to change the pads as regularly as they need to be changed. So if they are saturated, it's time to change it. Sometimes you'll need to change them more often in the beginning, and then as the drainage decreases, you'll change them a little bit less. Okay, you want to wait at least 24 hours to take your first shower. So that means leave the garment on from the time you leave the office until the 24-hour period. After the 24-hour period, you take your garment off for the first time, get your first look at how your body is. It's expected that you're going to be swollen at that point. You're still going to be draining after the first day. You can get in the shower. When you get in the shower, I recommend, if you can tolerate it, if it's not too uncomfortable, you can try to push out some of the fluids, put a little soap on your skin and help push the fluids out. The more fluid you get out, the better. Otherwise your body has to reabsorb the fluids and you potentially will get more swelling. When you get out of the shower, it's important to be very careful when you take this garment off for the first time. Your body's natural reaction is to send blood to the area that we treated, and if all the blood flows back to the area that we treated, potentially it's going away from your brain and you can get lightheaded and possibly pass out. If you do feel lightheaded, please just get close to the ground, and if you fall, the idea is just to protect yourself so you don't hit your head or knock your teeth out or any bad things like that. You put the garment on after the shower. You may want to get someone to help you out for the first few times until you get accustomed to it. You want to make sure that all the holes are covered appropriately. If you don't cover the holes, you may have some embarrassing accidents in public where the holes are not covered and the drainage gets onto your clothes. Which is why we always recommend wearing dark, loose clothes after the procedure, in case some drainage gets on the clothes. It's not as obvious, and you may want to do this for the next few days after the procedure until you stop draining. The swelling in the area treated will start to get firm and possibly lumpy, and this is just a swelling in your body's natural reaction. It's totally normal. There's nothing to be concerned about it, and it will go away. How long it takes for this firmness to go away, it varies widely from patient to patient. Some people say it goes away within weeks. Other people, it takes months. In fact, personally, I had the procedure and it took me about 3 to 4 months for that lumpy, bumpy swelling phase to go away. So just be patient. If you're happy with your results early on, that is fantastic, but it will get better. The swelling will continue to go down. If you don't see big results right away, that's still okay because you're swollen and you'll continue to get better over time. We usually say that you're going to see about 60 to 70% of your results at about 3 months. At 6 months, you're going to see closer to 80-85%, and over the course of a year, you're going to get to about 100% of your results. As far as the scarring goes, the tiny little puncture holes, they will close up within about 2 to 3 days. Usually, it can take up to a week for all the holes, and it's usually the lower holes that drain the most. Just with gravity, everything goes down, and those lower holes tend to take longer to heal. The scars from these holes are usually very small, about the size of a mole, and some things that you can do to encourage healing is put a vitamin E oil on those areas. I would probably wait at least a week until the scab falls off, then you can start putting vitamin E oil to help encourage the scars to heal better. You're going to want to go pick up your pain medication and your antibiotics. The pain medication is Lortab, also known as Vicodin. It's a hydrocodone. It has Tylenol in it, so we encourage you not to take additional Tylenol with the pain medication. The pain medication is as needed, so if you feel that you need the pain medication, then you can take some. It's available for you. Most people don't need it for much more than 2 to 3 days after the procedure. So if you feel you may need it, you might want to ration a little bit and not take as much all in the beginning. But it is important not to take Tylenol with the Lortab, since there's already Tylenol in it. If you take too much Tylenol, it could be toxic. The antibiotics that you will pick up are Keflex, also known as cephalexin. It's recommended that you take these 4 times a day, which comes out to every 6 hours. We encourage people to take, we encourage people to eat food with both the antibiotic as well as the pain medication, and if you don't eat food with them, you will likely get an upset stomach. Activities after the procedure. While you will be sore after this procedure, that's to be expected, we do want to encourage you to move around. Moving around, it helps out on a lot of different fronts. First, it's going to mobilize the fluid, so the swelling that you have it'll help mobilize the fluid and get that swelling out of the area. The other thing that it helps, people tend to feel like when you sit for too long after the procedure, you get stiff and more sore, and when you get up and walk around, it helps loosen things up and you'll actually feel better. So if you're feeling pretty bad, it's a good idea to get up and walk around, and I think you'll probably feel better. It also helps mobilize that fluid and helps you drain a little bit more, especially early on. In addition to that, moving around and walking helps decrease the chance of blood clots, which is a concern after any procedure, including liposuction. Blood clots tend to form in your calf area, so you want to walk around, and the only way the blood gets back up to your heart is contraction of the muscles. So you're going to want to walk and contract those muscles, and it'll pump the blood back up to your heart and decrease the chance of any blood clots. If you do experience significant pain in your calf area, this is the first sign of a blood clot, and you're going to want to give us a call as soon as possible so we can address the issue. As far as the swelling and the bruising go, there are some over-the-counter medications that you can take to help decrease the bruising. There's a medication you can get at a Whole Foods store called Arnica, and it comes in a pill form as well as a cream. So you can take this as directed on the bottle, and it usually will help with the swelling. And if you tend to bruise more, this may be a good idea for you to pick some of this up to help decrease the bruising. The garments after the procedure, there are a few issues that people have with them. You want to keep them on as much as possible to decrease the swelling, but it's not always very comfortable to be on the area that we just had treated because it's sore. So a lot of people, it's just about adjusting, trying to get it in a comfortable position. If you leave it in one position for too long, they tend to form ridges, and you'll see this in your swelling. It'll form a groove wherever there's more pressure, and this is just kind of pushing the swelling out of the way. And it will go away, it just takes time, but the more you can decrease these grooves by readjusting, it would probably get you better results. If you decide that you don't like the garment and you want other options, there you are able to go buy additional garments. We have a supply of the garments that you can buy additional garments. Say for example, if you wanted to launder one and then put the other one on, that's available. If you are interested in that, please speak with us before you leave the office. If you are already home and you decide that you want to get another garment, you can buy garments through Kohl's, Target, Walmart, Ross, any number of stores. They have undergarments that are tight, give you compression. Spanx is a good example of a brand, but there's a lot of other brands out there. You're going to want to find something that gives you good, firm pressure. The pressure is the important thing that you're looking for here. Beyond that, there's a lot of different options of different types of garments. So you're just going to want to find something that gives you good pressure on the area treated. Okay, some of the things that you want to be aware of for issues that people have after liposuction. And you're obviously going to be very sore in the area treated. Most people describe it as a very tough workout, muscle soreness, and just like a tough workout, muscle soreness, it'll continue to get better after each day. It's usually the first, second day that it's the worst as far as discomfort, and then every day after that it can just continues to get better as the swelling diminishes. People always complain about itching. It's something that is just part of the healing process. You're gonna go through it. It's gonna be uncomfortable. You're not gonna like it, but it will go away. Some of the things that you can do to help remedy this, you can get over-the-counter hydrocortisone cream and spread this over the area treated where you're itching. The other option would be Benadryl, which you can take oral tablets, and you can get that over the counter and take as directed. After this procedure, it's important that you stay well hydrated. When we do the procedure, we're injecting fluids into your body, then we're taking fat out. In most cases, it's a 1-to-1 ratio where we put in about as much fluid as we take out fat. So most people don't have any big fluid shifts, and they're usually not very dehydrated. On the other hand, if we put in more fluid than we took out fat, you may be peeing a lot for the next couple days. And if we put in less fluid than we took out fat, you may feel very thirsty. In the case that you feel thirsty, drink, but don't do excessive. You want to drink as thirsty as you are, but you don't have to overdo it and drink gallons and gallons of water, because that could potentially pose a problem in itself. In addition, drinking too much water could lead to more swelling. If after 2 weeks you take the garment off and you feel like you're swelling up a large amount after taking the garment off, you may want to consider wearing the garment longer. We recommend wearing it throughout the active swelling phase. At some point your body stops actively swelling and you take the garment off and your swelling doesn't change. So that's the point when you can stop wearing the garment. Some people who have looser skin, they tend to do better wearing the garments longer, as it takes the pressure of gravity off of the area being treated. So if, for example, your abdomen, you had loose hanging skin, and you take the garment off, it's going to hang. But if you wear a garment, it takes the pressure off of it and it allows for the body to heal and tighten up the skin to the best of its ability without the effects of gravity. So if you have loose skin, I recommend wearing the garments longer. How long is totally up to you. Some people choose to wear them for months after the procedure, and some people just the 2 weeks. Okay, so the night after the procedure, you will be draining quite a bit, and for most of our patients that are coming in from out of state, their concern is not messing up the bed because you get an extra charge for it. So we help our patients in, we give you, when you leave our office, we're going to give you a shower curtain, which is just a plastic sheet which you can put over the bed. And while yes, it is a little bit uncomfortable sleeping on plastic, you will appreciate it with a much lower bill the following day. So we have the shower curtain. Shower curtain you're going to get in your bag. You can open it up and just spread it out over the area. We will also give you, in your little to-go bag, you're going to get these blue chucks, and these are absorbent pads. They are waterproof, and you can open them up and put them on it. They have kind of a cloth finish, so they may be a little bit more comfortable than the shower curtain. If you choose to put towels on the bed, the towels may get stained, so I would be very cautious with doing so. And if you do, I try to wash them out as quick as possible so you don't stain the towels and get charged for them. Infection is always a possibility anytime you have a break in the skin. So we want you to keep an eye on the wounds. If the wounds drain pus, this is a sign of infection. It's also, the wound would look very red and irritated and be hypersensitive to the touch. So if you have one hole that's much more sensitive than the other holes, you may want to give us a call. The other things to be concerned about infection is if you have fever and chills, these are also signs of infection. As far as blood clots, what to look for. If you have severe pain in the calf area, this is the first sign of blood clot, and if you get this, give us a call as soon as possible. In regards to swelling, we're told time and time again that the swelling is less in the morning and worse in the evening. So you get up in the morning after sleeping, your garment's been on, everything's tight, you haven't been moving around, your swelling is at the least it's going to be throughout the entire day. As you get going, you're moving around, you're working, you're doing whatever you have to do, your body's going to start to swell up. So you're going to find that you look the best and feel the best in the morning, and as the day goes on, you're going to slowly get more swollen and feel a little bit more sore, a little bit more uncomfortable. So expect this. Everybody is concerned about their weight. Liposuction is not meant for weight reduction, although when you take out large quantities of fat, there's inherently going to be some weight loss. But initially, in your first week to 2 weeks, and sometimes even longer, you're so swollen that you don't see a difference on the scale. So don't expect weight loss early on. If we took out a large amount of fat from you, it's likely you're going to have weight loss, but down the line as the swelling comes down. And usually people see a slow progressive weight loss as the swelling decreases. So just be patient and don't focus on the weight. It's more important about your shape and your size. If you had your chin treated, we recommend wearing all the garments for 2 weeks. But if you had your chin treated, most people don't want to wear their chin garment in public or to work. So we suggest that you wear it for at least 48 hours after the procedure, and as much as you can after that for the following 2 weeks. Now keep in mind, the less you wear your garment, the more you're going to swell. The more you swell, the less you see the results, and the longer the swelling stays in place. So if you choose not to wear the garment, then the long-term results, 6-8 months down the line, will be the same, but the short-term results is going to take longer for you to heal and resolve the swelling. So if you choose not to wear your garment, expect more swelling and just be patient, because you will get better, it just takes more time.